Welcome and thank you for joining us. You're listening to the Beyond 50 radio program. I'm Daniel Davis. Today we're going to be talking about diabetes and the link between a low testosterone level and perhaps the occurrence of diabetes onset. On the program today, I'd like to welcome our guest, Mr. Sanjay Kapur of ZRT Laboratory, as we talk about the topic of testosterone and diabetes. Sanjay Kapur, thank you for joining us here on the Beyond 50 radio program.
Thank you, Daniel, for having me here.
Now, let's talk about, first of all, what testosterone is. I know a lot of people are familiar with the word testosterone when they relate it to, the high-energy sports, but what is it exactly?
Thank you, Daniel, for having me here today, and it's a really important topic that we will be talking about testosterone. Like, as you said, what is testosterone? That's a good way to start. We have lots of hormones in our bodies that interact with all kinds of physiological systems. And testosterone is one of those steroid hormones, which is mainly required to maintain our body energy and to maintain our immune function, helps in normal libido, helps in mood and cognitive abilities, and also protects against the osteoporosis, and basically overall quality of life. In men especially, it is responsible for different things like hair patterns and muscle mass and quality of voice modulation. But this doesn't mean that women don't need any testosterone. I mean, women also need testosterone, this hormone, but in very small quantities. And that's also to maintain energy, muscle mass, and bone strength. But yes, this is true that men produce almost about 8 to 10 times more testosterone than women. And the testosterone production basically increases during puberty, and then as people age, especially after 30s, 35, levels of testosterone start to decline almost about 1 to 2% every year. And it is because of this decline in testosterone levels that actually causes, like some people complain of low sex drive, or people get tired very soon and they don't feel as energetic as they were back in 20. And sometimes when there is a very large decrease in the levels of testosterone, people start to feel depressed. And basically loss of overall strength and overall quality of life. And since today we are going to be specifically talking about what is the link between testosterone and diabetes, I want to let you and our listeners know that there have been a lot of research and some studies have shown that men who have diabetes have been found to have lower testosterone levels than men without diabetes. So there's kind of a direct association there.
Now, that's interesting that a low testosterone level that men will tend to have, I guess, more of a rate of diabetes than that with normal testosterone levels. Why is that?
Well, that's a good question, and I hope that we find that direct answer. But the studies have shown that the low testosterone is actually associated with many other problems. It causes things like insulin resistance, where our insulin produced by the pancreas, it's not very active and it's not able to dump the glucose into the cells, and the cells starve and they die. And that's what basically causes type 2 diabetes. And low testosterone has been also associated with conditions like obesity, central obesity in our belly, the visceral fat, what we call it, and other things like metabolic syndrome. And all these things put together put an individual at high risk of developing type 2 diabetes and ultimately cardiovascular disease. And there's a lot of research that has shown a link between low testosterone with many factors associated with type 2 diabetes and cardiovascular disease. And those factors, like when I'm trying to say other factors responsible for type 2 diabetes, I mean to say that low testosterone has been associated with abnormal lipid levels. Cholesterol is messed up, triglyceride levels go up, and there is also increased inflammation. In some cases, there is high blood pressure. again, insulin resistance, and many other factors related to increased risk of atherosclerosis. But the problem is, this is still not very clear whether it is the low testosterone that causes type 2 diabetes, or is it that the type 2 diabetes develops first that causes testosterone levels to drop. Like some studies have shown involvements of like improvements in insulin sensitivity or the central obesity, cholesterol levels, or improved fasting glucose levels when they've used the testosterone replacement therapy. So testosterone replacement therapy has shown some kind of improvements, as I just mentioned, like fasting glucose levels are improved or improved. But at the same time, some other studies have shown that high doses of testosterone do not have the same benefits as shown by normal physiological levels. So basically, testosterone levels should be monitored both to identify hypogonadism, which is low testosterone production, and ensure that any supplementation, if people are going for testosterone replacement therapy, the supplementation is to be kept within physiological levels. So that is very important.
Now, that's also important to note because it seems this day and age as people receive messages about what they should be doing about their health and what they shouldn't be doing, it seems more is better and quicker and faster is the way to go. But you're saying that's simply not the case here.
Absolutely. Like more is not good and less is not good. So there's kind of a balance that needs to be kept, especially when somebody is going for testosterone therapy.
Now, tell me, Sanjay, what are some of the things that can deplete testosterone levels? It isn't just simply aging, is it?
It is, well, aging is central to all of the problems.
Sure.
But at the same time, we can definitely slow down, if not completely stop, the effects of aging by a good lifestyle. And actually, there are many things that can cause low testosterone other than the major factors that cause type 2 diabetes. It is the lifestyle. If we are not eating healthy, if we are not eating right, and a lot of stress, any kind of stress, job stress, stress at home, people who are depressed, or there are all kinds of toxins which are responsible to cause the testosterone levels to drop.
Interesting stuff here. Now, how could people, I guess, be tested for testosterone levels?
Excellent question. Well, people have to be smart enough to monitor themselves for any changes that they observe in their daily life or the level of energy that they have. Like there are several screening methods like mail surveys and questionnaires that are available, especially to help people and their physicians in diagnosis of hypogonadism. That's what we call it as low testosterone. And there's one called ADAM questionnaire. People can just Google search and the ADAM questionnaire is available. There's one called Andro test. And these are some kind of questions, 10 or 12 item interview questions, specifically designed for screening of low testosterone in men who have sexual dysfunction. And this could be actually very, very helpful in men who also have diabetes. And those questions are like, do you have lack of energy, or have you lost height, or are you sad or grumpy? Have you noticed any recent deterioration in your ability to play sports? Are you falling asleep after dinner? So on and so forth. So these questions, anybody can answer yes and no. And based on that, they would know whether they are a good case for getting tested for testosterone levels. And then it is important, very, very important, Daniel, to use a correct method of measurement. There are several tests available. There are different ways that one can measure testosterone levels. Tests can be done using whole blood, like serum, which is conventional testing. Testosterone can be tested in saliva and capillary blood using a blood spot method that ZRT Lab has developed. However, it is extremely important to use any of these methods depending upon what is the actual purpose of measurement. If we are measuring just the endogenous levels of this hormone, like if somebody is not on supplementation, so they're just measuring the basic levels, the endogenous level of this hormone, then it just doesn't matter whether we test in saliva or serum or capillary blood. But if the measurement of testosterone is to monitor changes after supplementation, if somebody is going to get testosterone replacement therapy, in that case, especially if somebody is doing any topical applications of gels or creams or sprays or something like that, then it is absolutely, absolutely important to measure testosterone in capillary blood by using the blood spot method. Here at ZRT, we have measured over almost the past 10 to 12 years levels of steroid hormones like testosterone, estradiol, progesterone, etc. in saliva and capillary blood from men and women who have used different hormone replacement therapies. And what we have found, Danielle, that testosterone or any other steroid hormone, when applied using topical creams or sprays or gels, the levels in capillary blood are way higher than what we actually see in venous blood, almost 10 to 20 times higher. So if somebody is measuring serum, they would not see any hormone changes there. And supplementing with large doses, because when they are not seeing any changes in serum, they would keep dosing, like overdosing their patients. And this is not physiologically normal. So if someone is using a conventional serum test to measure testosterone in men using these topical creams, they just might be completely overdosing their patients. And this might actually lead to increased levels of estradiol in those men and putting those men at high risk of getting cardiovascular disease. So what I'm trying to tell you here is that it is extremely important to use a correct method of measurement of testosterone, especially in men and women who are going on supplementation therapy by different methods.
Now, so it is possible that people can actually do too much.
Absolutely. So it is very important that if, depending on the route of administration of testosterone, if they're doing oral or buccal or any kind of injections, then basically it doesn't matter. But if they're applying creams, then if they are measuring or if doctor is measuring the conventional serum test, then definitely they will be overdosing their patients and putting those patients at high risk of developing either the prostate cancer or cardiovascular disease.
Now, why is it important? I know you talked about it earlier about maintaining good testosterone levels, but meaning, being in balance. Now, is there, I guess, a risk to overdoing it, I guess? Are there side effects even under normal circumstances if you use testosterone replacement therapy?
Absolutely. Like every other situation, when we do anything which is not natural, there are chances of risks involved and the side effects, as you just asked. And some studies have shown increased chances of prostate cancer. So it is very important that individuals should consult with their provider before getting into any kind of these replacement therapies. I mean, it doesn't mean that if you are type 2 diabetic and if you take testosterone, then you'll make type 2 diabetes go away. No, that is not true. And so people should not be just looking for testosterone over the counter just by hook or crook and try to get testosterone just because it's good. They have to be properly monitored and under their doctor's supervision. And in some cases, actually, testosterone replacement therapy can result in sleep apnea or mood disorders. And it can also affect sperm production as well. And so should be very, very carefully administered. And it may also cause increased hemoglobin or hematocrit in the blood. It thicken the blood and it can cause heart attack. So therefore, caution should be practiced in calculating the correct dosage. And that is possible only when a correct method of measurement is used to test the overall levels of testosterone. whether it is the endogenous levels or it is after any kind of supplementation. Again, it is very important for the doctor to know which is the best method to use for a measurement of testosterone.
Ah, interesting. Now, ZRT Labs actually works well in conjunction with a person's individual doctor, so it's not something that takes somebody off course. Is that true?
Absolutely correct.
Okay. And tell us about how they can go about that.
Well, as I just mentioned about the blood spot test, well, testosterone can be measured both in saliva and blood spot, but like if somebody has to use the blood spot test, we have developed these test kits that you can use for monitoring your own health, and you can actually be in the driver's seat and take charge of your health and wellness. But at the same time, when you're doing the replacement therapy, you have to be working in conjunction with the provider. So what happens is that this kit contains very easy step-by-step instructions. It has some cleansing wipes. It has a special card on which the blood drops are collected and a couple other things like Band-Aid and the Lancet. So, and you can get this kit either from your physician or you can call ZRT directly, or you can also visit our website and receive the kit in the mail. So, and this kit requires absolutely no special handling. And once you have collected your sample, you can return the sample to the lab for analysis in a The good part is that the collection at home allows for early morning testing, and also if you have to test several times during the day for other kinds of hormones. So you do not have to drive across town to get your blood drawn from your vein, and some people they just hate the venipuncture. I don't like to. So it's really important to skip the visit to a phlebotomist. So it's basically a nearly painless finger prick, and tests are very reliable, very accurate. And after the tests are done, after the analysis is done, a detailed test report and evaluation is generated. Available online or mailed or faxed to the provider within. Then the patient can actually discuss their test results with their provider, or they can actually call ZRT physician staff also to discuss what those test results mean. So it's really very, very convenient.
Now, here's an interesting thing to think about too, Sanjay. Let's say that a person goes along, low testosterone levels are there, then they get the onset of a type 2 diabetes. Is testosterone going to be one of those things, or replacement therapy, testosterone replacement therapy, one of those things that might be used to possibly reverse diabetes?
That is an absolutely million-dollar question, Daniel. Yes, diabetes is reversible. We know that by changes in the lifestyle and eating right and exercising and being active and all those. But at this time, there is not enough data that can tell us that, okay, if you're type 2 diabetic or if you have any kind of diabetes, type 1 or type 2 testosterone and your diabetes will be gone. I wish I could say that as of today, but there's not enough research, there's not enough data. Definitely there is research. There are some studies in progress as well, and based on the data that has been collected, which has very clearly shown that people with diabetes have seen improvements by testosterone replacement therapy. And possibly, it might be possible in the days to come that we might have some positive data that might tell us that. But Daniel, I think just by testosterone, I'm not sure if we can use it as a magic pill. That just by testosterone supplementation, the diabetes will be gone. I think it involves more than testosterone replacement by itself, because like I always like to tell everybody that our body doesn't work in isolation, and our body is like a watch. And all the cogs on wheels, if we compare those to all the physiological systems within our body. I mean, even water, it stops functioning, right?
Mm-hmm.
So testosterone by itself is not the only thing which is controlling the whole physiological system within our body. It is other hormones, interaction with the other hormones, and interaction with the various tissues and body. And so it is one whole big system. So just thinking that by using testosterone to treat or to reverse diabetes, I'm not sure if I would actually be very comfortable saying that at this time.
Well, that's reasonable.
Yeah. So
this day and age, even if you actually even hint or suggested a possibility, hear what I said. I didn't say definitely. I said hint or suggested a possibility. People say, well, they said, and then before you know it, you're in a lawsuit.
Yeah. So anybody who's listening to this interview today should not be a perception that testosterone is the answer to reversing or curing or treating type 2 diabetes. But like as I said, there have been lots of studies which have shown some kind of a association between low testosterone and type 2 diabetes. And those studies have shown that people who have diabetes also have low testosterone. So possibly there is some kind of association that there's something going on there where low testosterone, maybe it is the low testosterone which is causing type 2 diabetes, or it could be possible other way around as well, that maybe low testosterone in those diabetic people is because of type 2 diabetes. So we are not sure yet.
Oh, absolutely. So, Sanjay, if you can, for our listeners, go ahead and give out the website for ZRT, please.
Yeah, our website is www.zrtlab.com. And actually, there's a lot of information on the website. There's a lot of education material. Other than testosterone, there are lots of other things about various other hormones, and very, very informative. And there are lots of videos to watch. People would love those videos, educational.
Sanjay Kapur, thank you for joining us here on the Beyond 50 radio program.
Well, thank you, Daniel. Thank you so much for having me.
You bet. So again, folks out there, be sure to visit zrtlab.com. That's the place to find out more information about how you can actually keep diabetes from creeping onto your counter. We want to thank you, the listeners out there, for joining us. Be sure to visit us at our website, which is beyond50radio.com. Sign up for our free weekly e-newsletter. That's the number 50. And also be sure to visit us at our blog. I'm Daniel Davis. Thank you for tuning in. This is the Beyond 50 radio program. And remember, live your day past halfway.